There are endless questions surrounding the coronavirus pandemic and what happens next. I'm joined by Dr. Deepa Verma to get some of those answers for you. Doctor, thank you for joining us.
Georgia.
First, what has your experience been like in the medical field in the last few days?
I mean, there's definitely more heightened awareness and concern. So, as an MD, what I'm seeing in my practice, because I'm doing more preventative, proactive, are people just really taking grip and taking the bull by its horns and trying to be more preventative. So, a lot more increase in taking measures to boost the immune system and stuff like that. So,
let's talk a little bit about survival, because thousands of people have contracted COVID-19 and they have survived. Is that the case for most people who get this virus?
Yeah, I think what we are really focused on is the numbers, right? So we look at the fatality rate, and when we really look at like the flu, the influenza virus, the numbers are much, much higher, but we have a better handle on that. What we're looking at with the coronavirus is, we have 150,000, whatever the numbers are, and we're focused on the 4,000 deaths, right? So of course, when you get that mortality rate, it's going to be much higher, but there are over 70,000 recoveries. So I think we have to focus a little bit more on that and see, why are these people recovering? What's going on with those people who recover as opposed to just those people who are dying?
We have seen so many cancellations, large events, sporting events, school closings even, and we've been hearing a lot about this phrase, leveling or flattening the curve. Right. Exactly. Right. What exactly does that mean?
So these are basically preventive measures, and if we look at a graph, we're going to have a higher hump basically on the graph with non-preventive measures. Flattening the curve is, how can we extend this out so we don't overwhelm the healthcare system, the hospitals, run out of tests and things like that. It's social, distancing, social isolation. We're shutting down, the NBA, the NHL, MLB. We're, limiting, public gatherings to about 250 people or less. Social distancing is going to be the key. If you're not feeling well, quarantine yourself, isolate yourself. So we're going to see a lot of people just hunkered up at home and, taking those preventive measures not to spread the virus, because this is person to person, right? It's respiratory droplets. And I do want to emphasize that it's also airborne, and I had mentioned in a previous segment, which means, for example, if I cough or sneeze right now, it's going to linger in the air. And you come in a few hours later and those particles are still there. I'm not there, but you can still contract the virus. So that's what's really important about knowing for the coronavirus, how it's kind of transmitted. It's not just if I cough and sneeze now or if you rub your eyes or your mouth. So that's why washing hands, not touching public surfaces, subways, all those kind of public places. Wear gloves if you have to go. Masks, there's still, controversy. If you're well, you really shouldn't wear it because, for example, if I have a mask on and I'm well, I'm constantly trying to shift it, I might be just contaminating my face as well. But, keeping your hands clean. And, we have a problem right now because all the sanitizers and wipes and alcohol, everything is sold out. So I'm going to tell people, look in your house. If you have hydrogen peroxide, if you have alcohol, if you have like aloe, you can make your own sanitizers and, just wash, make sure you have soap. It's not about going and, the supplies are depleted right now. There's nothing we can do. Toilet paper, all the essentials. This is a pandemic. We're in a state of national emergency now. There's a lot of fear out there. And my goal as a physician is to allay and calm those fears.
Absolutely. We've been hearing a lot about testing. Just yesterday, Governor Ron DeSantis said the state is ordering more testing.
Right.
We heard from the president saying across the nation we are going to see an increase in testing. How crucial is that in preventing the spread of this virus to get more people tested?
We're going to encourage the testing right now, and because we're in a state of national emergency, that means the federal government has allocated about $50 billion where the states can use it. So what we need to do is encourage people to free testing. If you're not feeling well, go get tested. The more awareness there is, then the numbers are going to be more accurate, then we can understand what's going on and how many people have it. I mean, we have, 3 deaths in Florida. Just overnight, we had 25 new cases, so we're at about 70 cases in Florida. We have the West Coast, which is just being, bombarded. So most of these cases that we have to understand are people who have internationally traveled. And so I think that travel ban that went into effect, I think that was necessary. This is the way, again, we can flatten the curve and we can just prolong it and not overwhelm everybody.
Absolutely. We are running out of time, but one thing, and I know we've been talking about it nonstop, but those key preventative measures that people can take to stay healthy.
Just, again, if you feel like you're sick and coming down and, you're not sure, stay away from people, isolate yourself. Don't go into work, don't go into public places. Wash your hands, do the 20-second rule. Do not touch your eyes, your mouth, your nose if your hands are not clean. and just cover your mouth, and educating kids as well too. We're not seeing the cases in kids, but again, with now statewide closure of schools and a lot of parents and grandparents taking care, we just have to be aware of medical conditions. And if you have respiratory issues, I would advise you to stay away, because we can be carriers or not know it and not really ever fall sick. But if you're a carrier, you're going to be able to transmit it.
Something very important to keep in mind.
Yes.
Dr. Deepa Verma, thank you so much
Thanks,
for your
Georgia.
time.
Thank you.